Welcome back, friends, to another episode of the Juicebox Podcast. Angela has 4 children. One of them, her daughter, has type 1 diabetes. Today, we're going to talk about advocacy, looping, Hashimoto's, chronic kidney stones, other autoimmune in her family. This is a complete story. Nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan. Don't forget to save 40% off of your entire order at CozyEarth.com. All you have to do is use the offer code JUICEBOX at checkout. That's JUICEBOX at checkout to save 40% at CozyEarth.com. When you place your first order for AG1 with my link, you'll get 5 free travel packs and a free year's supply of vitamin D. Drink AG1.com/juicebox. If you are the caregiver of someone with type 1 diabetes or have type 1 yourself, please go to t1dexchange.org/juicebox and complete the survey. This should take you about 10 minutes and will really help type 1 diabetes research. You can help right from your house at t1dexchange.org/juicebox. Today's episode of the Juicebox Podcast is sponsored by the Contour NextGen blood glucose meter. This is the meter that my daughter has on her person right now. It is incredibly accurate and waiting for you at contournext.com/juicebox. The episode you're listening to is sponsored by US Med. usmed.com/juicebox or call 888-721-1514. You can get your diabetes testing supplies the same way we do from US Med.
Hi, my name is Angela Kritzberger, and I am the mother of 4, spouse to 1, and our daughter is a type 1 diabetic.
You just made me think, Angela. One day I hope somebody says I'm the spouse to 4, mother to 1. I can't use my whiteboard because I used it during a call for Arden for school, and she still hasn't written down everything she needs from it. So you have 4 kids. What are their ages?
So the ages are 26, 24, 19, and 15.
Wow. You're my age? You're 53?
I'm 52.
52. I just turned 53. How long have you been married?
We've been together 36 years, and we'll have been married 29. So yes, we were 16 and 18.
Wow.
When we met.
Were you the 16?
I was a 16, Yes. My husband's going to turn 54 tomorrow.
I have a question. Do you think that just happens because eventually girls mature more quickly than boys, and then they want to talk to somebody that doesn't seem dippy to them, so they go with older guys?
Most definitely.
Yeah.
I found a good one early in life.
That sounds like it. I was going to do the math, 36, and I had to carry a 1, and that makes that 4, and this is a 6, and then the 3, 16. You've only, you were 16. No, well, you knew that, but I was just proving it with my mathematics.
We've been together a lot longer
than you've been married.
Than we were alive, yes.
Yeah, than you were ever alive. How old were you when you got married?
I think we were 22 and 25.
Wow.
Something like that.
You met a boy when you were 16, dated him for 6 years, and then married him.
We didn't go to the same school. We grew up in the same area. We're both farm kids. And after we started dating, we found out that our dads happened to be best friends back in the day when, they were showing animals and all those connections. So it's been a pretty cool life because our dads had been friends since 1960, I think.
Oh my gosh.
Went to proms with each other's sisters, cousins, whatever. So anyways, it's been a pretty cool life because our dads, both my husband and I, went to college to our state university and got our degrees. He was engineering, I was communications, and we moved back home to take over our family farms.
My God.
So it's pretty cool.
That's
we were
like a
able
TV
to
show.
Spend our lives, part of maybe later. We just lost my father-in-law this year, and my dad suffered a stroke in March. So our lives changed quite a bit in the last few years, but we were able to farm actively with our dads for a number of years, which was pretty cool.
Isn't that amazing? At first, I was going to make a joke that you were grown on a farm when you said you were farm kids, but this is much more interesting. Did you go off to school with the intention of learning something that would help the farm, or did it just work out that way?
You really don't know if you're going to marry the person that you've been dating. I think that was probably in the back of our minds. And there were certain things, I knew my heart belonged back here. So I knew that I wanted to have a degree that was very useful, and anything that education was something I could have looked at. But when you put yourself in a very specific rural area, and if there aren't teaching positions for what, like, let's say music, I love music. The music teacher that we've had at our school system hasn't retired, for 30 years. So, I guess I went into communications. It's something that I was really interested in. Didn't know where it was going to take me. Business, knew it was very applicable, but I knew that my husband was going to farm, so, but there were certain things that I wanted to do before I got married, and so I achieved those and we got married. So one of them was going to Europe, and I sang in the concert choir in college and was able to tour all over Europe, which is a pretty cool thing.
Jeez.
So,
My
yeah.
God.
So anytime our kids have opportunities for doing those kinds of...
You send them on their way.
Yeah.
Yeah, that's excellent. You're going to tell me there's a lot of autoimmune in your family?
There's so much I had to write it down.
I used to hate ordering my daughter's diabetes supplies. I never had a good experience, and it was frustrating. But it hasn't been that way for a while, actually for about 3 years now, because that's how long we've been using US Med. usmed.com/juicebox or call 888-721-1514. US Med is the #1 distributor for Freestyle Libre systems nationwide. They are the #1 specialty distributor for Omnipod DASH, the #1 fastest growing tandem distributor nationwide, the #1 rated distributor in Dexcom customer satisfaction surveys. They have served over 1 million people with diabetes since 1996, and they always provide 90 days worth of supplies and fast and free shipping. US Med carries everything from insulin pumps and diabetes testing supplies to the latest CGMs like the Libre 3 and Dexcom G7. They accept Medicare nationwide and over 800 private insurers. Find out why US Med has an A+ rating with the Better Business Bureau at usmed.com/juicebox, or just call them at 888-721-1514. Get started right now, and you'll be getting your supplies the same way we do. Okay.
In the context of how you like to outline it. So I'll just kind of review it. So for myself, I've had hypothyroid Hashimoto's for 30 plus years. I've had celiac for 10 years, kidney stones for as long, unfortunately. So our family on the female side has thyroid issues. And then we have type 1 diabetes LADA. My maternal great uncle was diagnosed in his 20s and passed due to complications at 59 from not well-controlled diabetes. We have on my paternal side, type 2 LADA, and just kind of the normal aging process. So my dad, his grandmother, I've gotten into a lot more of the type 2 care recently because I'm close with my parents and he suffered a stroke. And so that's been a little bit different with hospital stay versus home stay. So really kind of digging into that and got him connected so that he could get the glucose monitor, like our daughter, to really study those trends. And then on my husband's side, he also has type 1 late onset. His sister was diagnosed in her 20s. She's since passed, not from diabetes, at 39. And then also type 2 LADA, just again, kind of the later in life genetic maternal grandpa. And then our daughter was diagnosed with type 1 diabetes when she was 7. So, I grew up in the 80s, and I think 70s and 80s, I guess. But, diabetes is the first thing that comes to your mind. There's just been now a determination between type 1, type 2. And so really or juvenile diabetes, really the conversations about, gosh, who had this and whatnot. And then all of these things start coming to your mind like, oh, I remember that lady at church. We always had to have frozen orange juice. We're a rural area. Right. Frozen orange juice in the freezer, and we'd have to make it quick for her, and she'd start passing out. So just things like that. And, oh, my uncle, I remember, what did he have? 6 Snickers bars, the week that he was diagnosed. Some of those things, but you're like, dang, I didn't know it was going to be, how did I not know the signs? So, my story, I would say, isn't much different than many. Mm-hmm. Everybody has that, but.
Tell me again, which one of your kids, type 1?
It is our youngest.
The youngest, the 15.
She's 15. Okay. Yes. I think I'm at the point now, she was 7, she's 15 now. She's had it for 8 years. It is important. And the more that I do work with advocacy, it's important really for the testing and the things that we've heard about and finding out where the connections, is it environmental, is it genetic? Yes, it's all of those triggers. But at the time, we were experiencing a lot of trauma. My father-in-law was diagnosed with non-Hodgkin's lymphoma the same week that our daughter was diagnosed with type 1 diabetes. And so everybody's story, you have a lot going on. We're farming. My husband had been taking my father-in-law to the doctor every other day, 30 miles away locally. Our firstborn was graduating from high school. We have a large farm. We were trying to get the planting in. There's just a lot going on. Did we see the signs? Didn't we see the signs? But just, my husband and I kind of conquered it and divided. I took my daughter's care. My husband helped, with his mother, with his dad's care. And so there's just a lot going on there.
It's a lot to do with having your own business and not being able to stop.
Yeah.
I see other people, like something goes wrong and they're like, well, I took some time off. And I'm always like, well, I got up earlier and stayed up later. Like that's how I handled my problem today because, I just can't do that. It's so odd that you said about your father-in-law. My father-in-law is at the end of his life right now. And my wife just went to just now, like literally 20 minutes ago, she left to meet her mom at the hospital to help her mom understand the care that they're going to give him at the end of his life so that, she can understand what to do and all that. And even my wife's at least has a job where she can call somebody and say, I'm going to go for a little while. I'll be back. But they also it's not a day off. They understand she'll just stay up till 2 a.m. and do her job or something like that,
Right.
But I watched everybody else last night. They were like, well, I took the day off or I had time. And I was like, oh my God, that's fantastic. I tell the guy I work for that I need off and he yells at me. So,
and I think that's the benefit too for us is that we have the opportunity to be able to have a more flexible schedule.
Yeah.
I'm in the Midwest, so we have inclement weather that prohibits us from doing, really any outside work from, freeze up until thaw. But, we work year round. I don't work in the shop specifically on equipment, but we do a lot of that work ourselves on the equipment. My in-laws, we're fifth generation technically, because the great-great-grandma came with the family here, on the original farmstead for my husband's family. And his parents built their retirement home just a half mile away from us. So we're very close. And my parents are 15 miles away. And now since my dad's stroke, I've been, I guess, really the primary advocate for him as well. The wonderful and the flip side of my father-in-law getting diagnosed 8 years ago was he just passed this year. So we had a lot of time with him. He decided to stop treatment when he had a reoccurrence because it was, lymphoma. It was going to surface again somewhere.
The Contour NextGen blood glucose meter is sponsoring this episode of the Juicebox Podcast. And it's entirely possible that it is less expensive in cash than you're paying right now for your meter through your insurance company. That's right. If you go to my link, contournext.com/juicebox, you're going to find links to Walmart, Amazon, Walgreens, CVS, Rite Aid, Kroger, and Meijer. You could be paying more right now through your insurance for your test strips and meter than you would pay through my link for the Contour NextGen and Contour Next test strips in cash. What am I saying? My link may be cheaper out of your pocket than you're paying right now, even with your insurance. And I don't know what meter you have right now. I can't say that. But what I can say for sure is that the Contour NextGen meter is accurate. It is reliable, and it is the meter that we've been using for years. contournext.com/juicebox. And if you already have a Contour meter and you're buying test strips, doing so through the Juicebox Podcast link will help to support the show.
The worst side effect, I guess, for him after the chemo and the treatment was he lost the ability to walk, but he was able to transition and be in a wheelchair and lived a full life and was on hospice for, I can't remember, 4 years, but was kicked off because
they were like, listen, you're not really dying. You got to get off hospice. Is that what it was?
Yeah. Our family joke was like, okay, kids, we better go, make sure we go to Christmas because this might be Grandpa's last Christmas. And we had like 6 last Christmases with Grandpa. And so it was amazing. And he just passed this spring. And we've just had a lot of things. Everybody has loss in their life, but he was just an amazing person and my dad's best friend. And so And it's been hard on my dad too. And then my dad had a stroke in March. And it was just kind of crazy because we had just buried my father-in-law like 6 weeks before that. And my husband had to, on a regular, not regular, but often help his dad when he had fallen. And my dad had fallen. And it was kind of like, my dad has 7 back surgery. We just thought it was his back. It's like, what's going on? And then it was a stroke. But the wonderful thing about all of it is, although we're rural, we're about 45 minutes from the biggest cities in our state in North Dakota. We have an amazing facility right here in my hometown where we live. And before I started farming full-time with my husband, my job was the foundation director at that medical facility. And we had a $13 million building and expansion project. And so we really have a full-scale facility that is, I think, really hard to match because we have clinic, X-ray, PTOT, assisted living, nursing home, skilled care nursing, emergency room. We just have an amazing facility. And I was really proud of being part of that because we had to raise $1.5 million for that building project locally for that project. And my grandma was one of the first residents in the nursing home, the long-term care. And I helped license the assisted living portion of it. I think just using my skill set. Again, why did I get a communications or business degree? I don't know. I use it somewhere.
Do you think your kids think the same way you did, like growing up? Like, because it's obvious speaking to you that like your focus was on community and going back to it and building on top of what was there already. But when I hear younger people talking now, like my kids and others, it's either like, what do I want to do? Or where can I make money? Like that kind of thing. But do your kids have the same community feeling, or do you think that's a time past?
Too young to tell. However, our son, our oldest son, is an educator, a wonderful person, and one of those lifelong learners, of which I think I am, but not to the level of he is. Like, if I could phone a friend, I should give you his number.
Yeah,
he's like Cliff Clavin from Cheers. We have the board game Fact or Crap, and he knows a lot of facts.
Yeah.
He's just a lifelong learner, but he moved back to our community because he did want to, very family oriented too. Yeah, I don't know. I think all of us want to see the world, but maybe we want to come back to our roots. And obviously with the family business is a little bit different for some of us. Yes, you can choose not to do that. But just for me, inherently, my call is to be close to home, part of this community. When I quit working, when you're a foundation director, you're involved in a lot, obviously asking for money from people for supporting the programs that are, at our facility. And that was a big one. After we had kind of got all the money in the bank from our capital campaign is when my mom had her first knee replacement, I think. And I just decided, this is the time. Both of our parents retired within 2 years. So it was a bigger operation where I needed to focus on the farm and focus on my family because I had been, raising 4 kids kind of on my own, managing a senior care facility on the side besides foundation director, just a lot of different things. I still am involved with that. I'm president of our Kiwanis Club, which is a civic organization that provides scholarships to our seniors. It runs the local food pantry. I'm on the subsidized housing board for senior citizens. We have 52 apartments. And then I chair a community foundation. And then I work with our local historical society. We have a 5-course prime rib meal with wine pairings at a Victorian Christmas. And so I do all the tickets for that.
When's the last time you were bored?
I keep myself busy.
Yeah, no kidding. I don't get bored either. And I wonder sometimes, I hear people all the time talk about like, oh, I was bored today. I didn't know what to do. Or I just hung out. I'm like, oh my God. I think that would be upsetting to me. As a matter of fact, everyone left a few weeks ago. And I made this big pronouncement to myself. I was like, I'm not going to do anything today. It was Saturday. I was like, I'm going to watch a baseball game. I'm going to get lunch. And by like 3:00 in the afternoon, I started getting uncomfortable. I was like, what am I doing? Like, there's so many things I could be accomplishing right now. I don't think I come off that way, but I feel like that. And are you, unless there's like, I don't know, murder a couple of people at college and you're trying to keep the voices quiet or something like that? What's going on exactly? Why do you think you are wired this way is my question.
I was born with a servant heart. That's all I can say, really. I'm a very empathetic person, which is good in some situations and not in other situations, I guess. But my calling is to help people. And I guess that's why I really wanted to touch a little bit on advocacy work. So I guess that's just who I am. And I've accepted that. And I when I have spare time, I don't feel it should be wasted. Although, trust me, I do get bored sometimes and I can't think of something to do. And then I feel guilty for even thinking, gosh, should I sit down and read for 30 minutes? No, I can't do that. I have this to do. But I think, all of us have our ups and downs and whatnot. But I guess this is just.
Yeah. I believe some people hear that and think, oh, that poor woman, she has no downtime. And then there are other people who think the way you do that are like, no, this is great. Like, I don't feel like you don't feel like you're working, right?
No,
I never feel like I'm working.
Well, it's funny because, for all of my life, my kids grew up, my office was in a senior apartment complex. It was a congregate housing. And so I was manager of that. And that's where the foundation office was. And it's a beautiful place. It's not connected to our medical facility, but it was initiated by our foundation and medical facility. And my kids grew up with knowing, oh, mom's got to go. There's, I have somebody moving in. I mowed the lawn there. I did snow removal. At that time, I also did all of the bookkeeping for our economic development group, help promote housing in town. I mean, they just, use the skills that you have. And anyway,
You're the living embodiment of that joke about like sticking a feather duster up your ass while you're running around the house. You can do one other thing while you're doing it. You know what I mean? Like, oh my God.
I think my kids would, they have shared the memes about the mom cleaning before Christmas. And I think the funniest one was everybody's sitting in the house at Christmas. Obviously, we have snow here, waiting for me. I've done the cooking, the cleaning. I've wrapped all the presents. They're just waiting to open presents. And I'm out shoveling the driveway. And by any means, my husband he gets up at 5:30. We don't have animals on our farm. We're a small grain farm. Gets up at 5:30 and gets done with work at 8:30. He's, he'll say I work as hard as him, but that's not true. But anyway, we get in and then I open my present and I can't remember. It was a sign that I had for years and it was something about nobody works harder than me or thanks for watching me. So I don't know. It was some meme, and my kids like to say, I turn into that monster, pick up your room. I never forget telling my son, in the laundry room, if you don't get your stuff out of here, I'm going to have a heart attack right now.
I was going to say, do you think you have anxiety or is it just from growing up on a farm that you're just work focused?
I was involved growing up. To the extent it was so different in that lifestyle growing up. We didn't have the scale of farms. Farms have grown considerably just from economics and being able to make things work. A small farmer just can't make the numbers work. You can't have hobby farms really and make a living at it. So just the scale of it, it was really different. For me, with my husband being so busy, I don't remember my dad being gone as much as him. So it was different raising kids. Like, dad's not home. That was always hard. It's like, daddy will be home later. It's okay. I have these little kids that just love their dad and they don't see them. His hard work pays off, in the end too, because this lifestyle is one that supports generations.
Do you think any of the kids will keep the farm going? I can't even get Arden to decide to be on the podcast more often. So I'm wondering how you would accomplish that.
Too early to tell. But for us, we're fortunate that my husband, when we started dating, he had a brother that was born. So that was new to me because I grew up in a predominantly Protestant community and my husband's family's Catholic and my husband's the oldest of 8. And so when we started dating, he, a couple of weeks later when he asked me to prom, he's like, oh, I just had a baby brother. I'm like, oh, okay. And it's been awesome because I love kids and he started farming. So the transition for us is him at this point. If our kids want to farm, maybe there's an opportunity for them, but
they can do it with their uncle then. Oh, so he's 17 years younger than your husband, maybe.
He's 36 right now.
Wow. But that's a
which is kind of crazy because, I saw something on an ad on whatever, and it was Cocktail came out starring Tom Cruise in, July 26th, 1988. I'm like, I know that because that was my first movie that my husband and I went to. It was 36 years ago.
Cocktail.
So.
Wow. Yeah. Look at you. Showing your age.
Yeah.
That's crazy.
I haven't gotten carded in a while, so I can't, use that. But, it is what it is. I guess I woke up and I'm alive today, so we have to go with that.
We're going to keep going. Your mother-in-law, her uterus fell out in what year? 96? Like, when did she just I
don't know.
How many kids did she make? 8?
Well, yes, 8 that 8 that I knew. Yeah.
Oh my gosh.
Well, I shouldn't say 8 that I knew. They did have a a son that died early.
Oh, I see.
But
oh my gosh.
yeah.
I have a couple of weird little questions. So this one's just sticking in my head so long, and it's none of my business. So you can just tell me to, go to hell if you don't want to answer it. But how does a 39-year-old woman die? Is that like tragedy or an accident or?
An autopsy wasn't performed and she died in her sleep. She had complications from, I wouldn't say complications. It wasn't from diabetes. Her blood sugar was normal that we know of.
There's no way, you don't know. How about that?
No.
That's really something.
My great uncle. So I talk about him, or not my great uncle, I'm sorry, my uncle. So my dad had a lot of tragedy at a young age. He had a brother that died tragically in a farm accident at 14, and then his father passed away a couple years later. So my dad at 19 kind of had to help guide and support his mother, who had a 4-year-old at home still.
Ooh.
So that uncle, again, my grandma had him later in life. He was more like a cousin than an uncle because he was, closer in age to us. He late onset with diabetes, and this was the 80s. They didn't have Juicebox back then, Scott. It was, we knew insulin did something to food, but were you counting sugar? Were you counting carbs? What were you counting? I just look back now, and I was trying to help my uncle get a CGM just to help train him and teach him and trying to get, he's trying to get disability. And he just, you think about the lifelong complications of missing work and not keeping a job and whatnot. So it was hard to watch. And I didn't truly understand the effects of type 1 until I looked back at his life, because ultimately what led to he had neuropathy from head to toe, literally, in his intestines, in his hands, his feet, everything. And he suffered a massive heart attack, went into diabetic coma, suffered a massive heart attack, and passed away in a nursing home at the age of 59. And it was obviously many, many years leading up to that. But, did he test? I just remember him always carrying, I suppose it was a syringe, a vial of insulin. I don't know if he tested, maybe not.
Mm-hmm.
I wouldn't say my mom was hesitant to my dad getting a glucose, monitor. We have the information, let's use it. Oh, well, it's a snapshot of time. But now when you have the data and you can see the trends, and that's why I'm fighting so hard. I don't think people really understand, other than people in our arena, why I work so hard to keep our daughter healthy, because I don't want the bad things to happen to her later in life. I want her to have the tools that she knows so she can go on to live a long and healthy life. And now we have the information, so we should be using it.
Your daughter's diagnosed. How much of that memory floods to you?
I think, like many stories, you start thinking, is it cancer or is it diabetes, without even verbalizing it?
Mm-hmm.
So I had the normal, took my daughter, and I wouldn't say normal, but it's a common theme along a lot of people. I had taken her into the emergency room and she had lost a significant amount of weight. And the provider, she's just at that age. She's starting to lose weight and look at herself in the mirror more. And like, no, 10 pounds in a month. No, she's 7. That's like happens when they get their periods and they're like 10.
The doctor thought that your 7-year-old looked in the mirror and thought, I need to drop 10 this month. Boy, isn't that interesting? Okay, but go ahead. I'm sorry.
It's just one of those things, So anyways, and she was just sick. And yes, like I said, the lady at the church who we had frozen orange juice, my uncle who, had just all of the people. And then my sister-in-law, my daughter did get to know her aunt that suffered with type 1 diabetes. And she had access to a pump, but not to a glucose monitor, insurance and all this and that. And so she would talk to our daughter, Nina, talk to her about what's your care and what are they telling you? And, to kind of doing comparison. And I know that's weighs heavy on Nina's heart sometimes. Her aunt didn't have what she had, maybe.
Yeah.
We're self-employed, obviously. So we don't have access to insurance other than paying for our own commercial plans that are available in our state of North Dakota. And North Dakota only has 3 major carriers. And obviously it's about your risk pool, right? So we have not a big risk pool, and we don't have a lot of options. We pay a lot of money for our family to have insurance. We've just stuck with it because it's what gives her glucose monitor. It what gives her pump supplies. A part of the advocacy for us, it sometimes feels self-serving, but it's everybody needs access to insulin. Everybody needs affordable insulin. And when I went in to fill her prescription, this wasn't the first time that I'd gone in. It was $1,100 for her 4 week supply of insulin.
Oof.
So that's what we were paying for insulin. And I can touch on that a little bit later. But getting back to Nina and her diagnosis, she was born, the mom guilt. So you try to psychoanalyze, like, what happened here? She was born prematurely because I had chronic kidney stones. I was externally bagged and they had to take her early. So about 5 weeks early. I didn't get to hear that first beautiful cry from the baby. She went into the ICU for a month. Then she was brought home and she really was a healthy baby. At 5 years old, she had strep throat, inflammation, which I had 3 kids that had their tonsils removed. So, it's just earaches and sore throats. It's just stuff that happens with kids. But when she was 5, she had this bizarre thing. And I went back in her medical notes just to see, when you ask about triggers, where do you think, Angie, did it happen? Well, maybe genetically. But she had swollen lymph nodes around her entire abdomen, and she could hardly sit up or lay down, and she was moaning and groaning, and it's something that her body was fighting off. Didn't really have any specific diagnosis for what it was. And then I look at the blood work at the time, and it shows her blood glucose level was 110. And, I'm like, why didn't they see it then? But again, that was just a snippet in time. So then fast forward 2 years later, here we are.
Right.
Ear infection, respiratory infection, in the ER. Oh, just, generalized abdomen pain, and looking in the mirror, she's lost 10 pounds in a couple of months. And then you start going, okay, thirsty, weight loss, headaches, belly pain. And I just remember sitting at softball and it was hot. Just saying, Mama, I can't today. Mama, I don't feel good. And then I looked in her throat and I saw something on her tonsil and was like, this is weird. So we made another doctor's appointment and she looked her over and she said, oh, that's a tonsil stone. I'm like, that's what it is. This girl's got to get her tonsils out. She's sick.
I figured it out.
So
yeah,
I figured it out.
Yeah.
Anyways, so that's the first time I heard about a tonsil stone. But our physician's assistant that I know everybody here. Obviously, I worked at the medical center with everybody and grown up with some of them and have known them forever. But anyway, she said, let's do some lab work. And we were at an offsite location clinic, not one right here, just a few miles away. But okay. So Nina said, I want to do it back in town. So we did it there and then went to see my father-in-law who was in the hospital. That's why I remember exactly. He had gotten his diagnosis. We did labs and then went to see Grandpa. And then we got home and I got a call from this physician's assistant. And you don't get a lot. She said, I'm going to come out. We need to review her labs. How many times do you get a house call?
Coming out to your house?
Yeah.
Wow.
Yep.
Did that scare the shit out of you?
She said, your life's going to change and it'll be okay. And so, yeah, she's like,
She said that on the phone?
Yeah.
Oh, you got to wait while she got to your house to figure out how your life was going to change?
I don't remember if she told me over the phone.
Oh, okay. All right.
She probably did. No, I don't remember, but she came out with the papers showing me. And I think one of the primary reasons, obviously she's a compassionate individual, but I think one of the reasons that she did is it touched her personally. I think because her roommate in college was a type 1 diabetic.
Oh, I see.
So she lived directly with somebody and understood the gravity of it. So anyway, so we're always very thankful for her, for going that extra step and whatnot. So then in North Dakota, I'm not familiar with all of the care, but with one of our major providers, one of our major medical systems, which is just Fargo, not the movie. Nothing like that. But the wood chipper is at our tourism center. If anybody wants to come to Fargo, North Dakota, Coen Brothers movie. It's terrible. I don't talk like that, I don't think. But our major hospital is there. So that's where we drove and found out that her blood sugar was 600 and her A1C was 12.
Oh.
And then the provider had said, well, they have 3 pediatric endocrinologists. So we're really fortunate in the 8 years of her care that we have 2 of those providers are female and have type 1 themselves and another provider. So we've just had phenomenal care. So we're really lucky in that sense. They say with an A1C like that, she's had it a while and you're like, ugh, how did we not see it?
Angela, you saw something. You just couldn't figure out what it was.
Apparently I was really busy to see everything because at her son's high school graduation party, Nina admitted, she's like, well, yeah, Mom, I had 6 Sprites and I had 10 cupcakes. I'm like, oh, why did nobody count those?
You have a farm and 4 kids and a husband that works 18 hours a day. And I mean, do you feel badly about it still?
There's nothing that I can have. There's nothing I could have done to prevent it.
No, I know, but it doesn't weigh on you? Or did you have to talk yourself out of it weighing on you?
I probably talked myself out of it a long time ago because you don't have time, right?
Yeah. Well, you don't.
I mean, no, but mentally, I mean,
No, I
you
know.
you have to live in the moment. And just a little bit, we didn't get a glucose monitor. This is back in the day before they gave them to you when you were first diagnosed. So I slept by her side. My husband doesn't remember this, but I slept on the floor in her room and finger sticked her every 2-3 hours, 24 hours a day.
Mhm.
And her honeymoon lasted a year. And it was rough at first because, with that honeymoon, you don't know when they're going to spurt out some insulin. So she'd have some bad lows. And I remember I think it was 32. I didn't think your monitor could go below 40, but I remember 32 and just kind of holding her. And she just kind of looked at me with her little eyes, said, "Mama, just let me go. I can't do this." And it's like, oh, yeah, no, I'm not letting you go. We'll be okay. So we've had a lot of experiences
Can I have
together.
more context with that? Let me go. What was she saying?
I have no idea. She was 7. I don't think she has a clue what she was saying. She probably just wanted to say, "Let me go to sleep." But not my brain. Not my brain.
Yeah. You heard, "Let me drift into the ether. It'll be okay. I'll see you in heaven." Yeah. No. Oh, okay. Jesus Christ. Yeah, what?
Don't look up dead in bed.
No, I know what that is. Yeah.
Yep, okay.
Yeah. How long did that panic you for? That idea?
I've had physical therapy. I have degenerative disc disease like my dad and some other things. And my physical therapist, I listened to another podcast about chronic pain.
Mm-hmm.
And she said, "You are in a constant pattern of fight or flight." And I said, "Yes, I think I am. So I'm working on that." But I think with this disease, knowing that I am a primary caregiver, you do feel like you're trying to keep them alive.
Yeah, but let me tell you something too. You also have autoimmune stuff, right? And
yes.
Anxiety, like I see with a lot of people with autoimmune, the inflammation in general, even like you said earlier, you said, like I get a lot of kidney stones. And I thought that's not autoimmune, but I looked into it. We never got back to it, but it could be something like hyperparathyroidism could generate, right?
I have done all of the workup at the Mayo Clinic. I've had my kidney stones actually analyzed, and mine are from lack of, I'm supposed to drink 2 gallons of water a day, I think. So,
you're just not hydrated enough for your body because you have too much calcium.
Yes.
Interesting.
That is correct.
Huh.
I don't have Diet Coke kidney stones, so I'm not like drinking tons and tons of sodium where I'm creating them myself. No, it's just for me having a lack of fluids. I can't remember where we're at, but
Angela, it's okay because I'm going to pivot you. That's okay.
Okay. All right.
Because you are, I don't know if you're aware of this or not, you're chatty.
I am.
Yeah, which is fantastic for a podcast. But I don't want to miss the things that you wanted to talk about either. So I think you went over how important you think advocacy is. But what about looping? You want to talk about looping as well?
Yeah. So just for the glucose monitor, we didn't get it covered for, I think, like 3 months, somewhere around that time frame. So we got the glucose monitor. Then we had to wait 6 months to get a pump. So we waited 6 months to get a pump. That was what she wrote in our local paper for Christmas, is all she wanted for Christmas was a pump. Well, she didn't get it, but her birthday was January 6th, and she got it then. So we had the Omnipod. I think everybody has this, well, maybe not. Things have changed dramatically, but she got the pump and we're like, yay. And you're like, what? The glucose monitor doesn't like put in the blood sugar into the, I swear that control for the Omnipod, the original one, feels like a game of Pong. You remember that growing up. It's just so archaic.
It was something, wasn't it? Yeah.
Well, so anyway, she was on the Omnipod for however, and I had heard about this do-it-yourself hacking, the insulin pump or whatever. And at that time that I was reading the articles about it, it was getting a solder gun and welding your own link. This is before the makers of Riley Link, I think.
Oh, I remember that. Yep.
And I'm just like, oh, hell no. That's not in my, I probably could ask my husband, but I'm not getting a motherboard and trying to, that's just not in my arena. I came back to it in the fall and started thinking about it. And then COVID kind of hit. So I had been working on it and reading, the loop docs. And so I decided, I'm going to jump in. And then COVID hit and was like, this is the perfect time to do some testing. And so got in a few Juicebox pod Zooms with everybody. And, I joined SoCal Loopers and got to know everybody there. And she has been looping now for over 4 years. And it's just been, Yeah, amazing. You can't even understand. People don't realize. I'll never forget. It's one of those memories is burned into your mind. I don't remember if it's the first night, first a week after we started looping, but I went to bed and I slept for 6 hours. It actually held, so our numbers were fairly good in her system. But I woke up and went, I hadn't slept
like
through
that.
the night in years.
Was it like a light went off? You're like, oh my God, I might not die. This is going to be fantastic. Yeah. Hey, weren't those Zooms great during COVID? I did that. I just felt like everybody needed a place to go. And I know that wasn't like a unique thing. A lot of places tried it, a lot of orgs and like, oh, we're going to do live Zooms. But mine really took off. Like we were doing like 300 people at a shot during COVID. And I mean, there were just screens and screens of faces just chatting about diabetes. Is that when you found the podcast?
No, I heard about the podcast early on, actually, kind of getting back to advocacy and whatnot. But when she was diagnosed, a couple of things. I found a Facebook group, a local Facebook group by a mom who started it, who didn't want anybody to feel alone.
Mm-hmm.
And she actually has become one of my very best friends.
Oh.
She's in Minnesota. So she's done advocacy work with the Alex Smith Insulin Affordability Act in Minnesota. I'm on the North Dakota side, but we're, a state divided by a river is all. Anyway, she sent a video. I was freaking out because you remember the G5?
Yeah.
That horrible plunge? I didn't do it in the doctor's office and I'm 50 minutes away and I want her to have it, but I'm freaking out because I didn't know how to put it on her and you had to do this first and then that and plunge it and yada, yada. Anyways, she sent a video and she's like, it'll be okay. It'll be okay. This is how you can do it. She helped me there. And of course, since I'm a talker, I lost my train of thought.
No, you want me to help you?
Maybe.
How did you find the podcast? Was it the Facebook?
Yes,
No, I met a friend. Go ahead.
Thank you. And then because, yes, thank you for that. I need you in my life more often, Scott. No, not really.
Am I in your life too much, Angela?
Lately, yes.
Yeah, not
because
too
I've
much.
been walking 2 miles every night, listening to a podcast every night. Okay. I'm really trying to hone in here and catch up.
Okay.
But no, the important thing for me was for Nina to find somebody else that had the same disease, that somebody looked like her, felt like her. And so I went to a mom's group and we were sitting there and we weren't on a pump at this point, and they started talking about the pumps and how you figure out your basal rates. And my eyes started to roll back because at that time we were on Tresiba and short acting. I don't know what you're talking about. And then one of them said, well, actually they had started working with Jenny, or not Jenny, I don't think, but with integrated diabetes.
Yeah.
They took it upon themselves to do that, said that, we learned about it on the Juicebox podcast. And so that's what we're doing. And so, something sticks somewhere for somebody.
Right.
And so I'm like, well, that's interesting. So then I started, listening to it off and on. And so that's where, I started. I haven't listened to all 1,600 episodes.
Well, there's only 1,200. Don't make me sound like a lunatic, Angela. Okay.
Well, I think you were like at 300 when I first started listening, so it's just, it's amazing, so kind of got it on it early on. This looping community is just amazing. And it is just mind-blowing. And I think that was my tag along to you when I emailed you about being on the podcast, is growing up in the 70s with Bionic Woman. There's just that moment where your child's body is taken over by electronics. It's a choice for certain, but it's a choice you make to keep them alive, to give them the best life forward. And so she had her CGM on one arm and her Omnipod on the other arm. And I had the Bionic Woman doll. And I was thinking, this is really cool and everything. I'm like, God, I remember on her arms, you could plug in stuff and do that. And then I looked at the one online. I'm like, I should get one of these and give it to her. And like, no, I don't think so. Because I think you can take part of her face off. And no, I don't think so. But
Angela, I just want to prove what a television kid I was. So the Bionic Woman, who was in like the CIA, for real, but she had a job. You remember what her job was?
No.
Was she not a college professor, but like a tennis pro too, or something like that?
That's tennis is, visually.
There's a lot of tennis.
I can picture Linda Wagner, and I can picture the $1 Million Man too.
Mm-hmm. $6 million man. Don't short him.
6 million. Okay, sorry.
That's Lee Majors. He was also the fall guy. Okay.
Yes.
And
Knight Rider. Oh, there's
That
yes.
whole time of those TV shows is crazy. But yeah, I remember one of the feats of strength was her crushing a tennis ball. Do you remember that in the opening?
Yeah.
How ridiculous that idea is. Like, oh, she broke a tennis ball. Does that mean she's that strong?
Yeah. All I can think of was those ports on her arms,
Yeah. Isn't that
in her
funny?
legs. That's just all that came. But so kind of just getting back to advocacy a little bit, I'm very proud. And I think my tagline to you about advocacy is we got in early because another mom whose daughter had been to the Children's Congress for JDRF, which is now T1D Breakthrough, had come back and was working on strategies for getting insulin affordability because that was a hot topic, 8 years ago.
Mm-hmm.
We've been through 3 sessions. We've had a concurrent resolution, a failed bill, and then last legislative session, we were able to get Senate Bill 2140 passed in the state of North Dakota because of the laws and the mandates. We weren't able to get it for everybody on all plans, but for state employees for 2 years, kind of as a study. And then we'll be going back out. But Nina has been directly involved with this advocacy work with me since that time. The first bill that I helped with, I don't remember the number, was to get people that were on Medicaid a CGM. Mm-hmm. And so that was expanded for people. So just trying to get some of this technology, but insulin affordability. There's just a lot of things. Anytime you can get in front of anybody, education is always obviously the number one thing that we have to do, and we continually do, is just educating people on the disease. So they understand, like law enforcement thinking that your child is drunk. No, they're not drunk. They have low blood sugars, just so there's just a lot of anytime you can do education and advocacy is good. But for her, she has presented when she was a member of our 4-H club at her school. She's gone to diabetes camp. She puts together care packages for kids, and she mentors young people that are diagnosed with type 1 diabetes and will be a counselor at camp. She handwrote a letter to our governor who ran for president, Governor Burgum, gave it to him at our district meeting and asked him to please make insulin affordable for everybody, because that's something that really weighs on her mind is when she ages off of our insurance.
Yeah.
Will she be able to, she's like, Mom, I think I want to be this. And I looked at her and I said,
Are you sure you don't want a job with a Fortune 500 company that has really great insurance? Are you sure?
Yeah.
Yeah.
That's pretty much, what we've talked about. And we just say, we're working harder for you to make things better. And hopefully it'll be, better then. But she's been an advocate with the American Diabetes Association for, a major giving program that happens every year in the state. And she was actually on the House floor and was able to go for the vote to pass. It's been a really, really neat. I don't think that all kids have been able to have that experience, but she is just really out there, not afraid to talk. And then in our school, we have a program called Close Up, which allows you to look at the government close up. And so we take kids that are juniors and seniors out to Washington, D.C. every 2-3 years. And it's a whole program called Close Up.
I'm going to call this episode Angela Makes You Look Lazy. And
Okay.
that's going to be the title. People are going to be like, oh my God, like you're either making this up or you're super person. You know what I'm saying?
No.
I don't think you're making it up. But like, still, I can't get my head wrapped around it. Like Arden applied for Children's Congress. They turned her down. So like, but
Nina, hopefully we're going to apply this fall. And I'm really hoping because it's her last chance to get out there. But if we don't, we'll be going the next year, or maybe it's the same year actually, for Close Up. Because when she's a junior, she'll be able to go to Close Up and do this as well. But when I was out there, that is when the Senate passed, I can't remember now, Congress was looking at insulin affordability. And then of course, everything fell apart, and here we are. We haven't gotten anywhere federally, and we won't, just because of the environment that we're on right now with an election year and getting things done. But we feel pretty proud of the work that we've been able to do, and we'll be going back out to try and get them to get this affordable insulin. Our actual bill was copied off of Colorado's bill, and what it does is provide insulin for $25 for 30 days, as well as basic insulin supplies. And there was a lot of education, and right now capitalism is something that we hear a lot about in our state, and they don't necessarily like having some people have opportunities for a reduction of their medicine.
I was going to ask, how does it work? Like, it's not $25 for like every living, breathing person, right? So what is it? Who qualifies for it?
Right now, people that are on the state plans. So that would be your legislators and any North Dakota employment public employment retirement system employee.
Okay.
So whoever, North Dakota PERS, whoever is part of that plan, it could be whoever opts into that. So it could be, your state employees. Most schools have gone to self-funding their own plans, state employees and other people like that, which includes the legislators. But there's a lot of things that we learned, and there's a lot of things that we just continue to educate on. They didn't want to, some of it's HIPAA, but the data's there. At the time we were pushing for it, said, well, there's only 700 insulin dependent people. The second time we were out there that, it's only going to affect 700 people. Oh, who cares?
Yeah,
that's 700 people that can have access to insulin.
Right. And if that could spread from state to state, and if it's the least fortunate of every state that can't afford it, then that's really fantastic. Because you got to imagine people with insurance are probably not paying that much more for it to begin with. They're paying for their insurance as well, but like out of pocket. Is that not correct? Well,
and for us, here's the crux that we have. So I just want to touch on one other point. So we had been working with drafting the bill before it was actually introduced and hitting the floor. So there was some high-level involvement in committee work done before the bill could be introduced in the regular session, because we meet every other year. And so there's a lot of things that we were able to work with legislators on. But some things that we learned were that the rebates that the insulin company or the pharmacy benefit managers give to the insurance companies, they use to spread across all the premiums. And so it was like $2 million that was being subsidizing the premiums for the plans. And it's like, shouldn't we be getting that because we're being the ones prescribed that? So there were some things that, just like on the federal level, things that come to light that you're trying to advocate and educate people. So when people say, well, you're making our insurance plans go up. No, we're subsidizing your policy. Because these insurance companies did have a little bit of a heads up that we were working on this. I went out to give testimony in January about, this bill. I went to the pharmacy to fill my daughter's insulin. It was $5. It used to be $1,100, but it was $5 because this insurance company had proactively been working on getting insulin or some of the top tier drugs more affordable. So it's just kind of interesting that happened. But for our particular plan, we have a high deductible plan. So we pay, I really don't want to talk numbers,
but a lot,
a buttload of money in premium, over $2,000 a month.
How many bags of grain is it? Let's think of it that way.
A lot. Yeah. A lot.
Right.
But then we have a high deductible plan. So then what happens is you pay the premium every month, but then we also have a high deductible plan. So we have $5 insulin, but we have to pay, when I walk into the pharmacy, we have to pay the first $5,000 for any of the glucose monitors and insulin pumps.
Yeah.
Diabetes supplies. So, there's just a lot of education, and very thankful that because she has type 1 diabetes and that we have healthcare environment right now that allows a person with this pre-existing condition to have access to insurance. I have a very happy and healthy daughter, and I'm so glad that we have, we're able to have access for her. But there are so many people. We did have an instance in our, we network with people. We have over 1,000 people in our Facebook group that's for advocacy, resources, and support. And we're just everyday people. We're moms, but a lot of us have backgrounds. So the primary people that were working on the insulin bill in North Dakota was me, another mom, as I said, whose daughter had gone to Children's Congress. And then we had another mom who was a lawyer. And there was a core group of about 6 to 8 of us that were working on this, with a couple of us being the most vocal, in the news and whatnot. But change can happen. And I just want people to get to know who your local representatives are, because it's about making contacts. I have all 3 of my district members' cell phone numbers, and most of them are published on the state site. So I've got our website as a regular tab that's always open. And it'll be an election year this year, so a lot's going to change in the landscape. But there's just a lot of things that you can do. It comes down to people's stories, talking to people, making them understand, because everybody has somebody with diabetes in their family.
How would you say that people could go about getting involved locally if they wanted to?
I think as just a everyday citizen, what you need to do is finding out, vote, get to know who you're voting for, vote, and find out what committees do they work on. Because they all work on different committees. One of mine is on education and infrastructure. Still is going to vote on the bill, and they're in the Senate, and because we have one senator, two House of Representatives in our state, so it's opposite on the federal level for us. We've had meetings with our senators as well. Very frustrating. Things don't move fast, and you don't feel like you're really being heard. But we continue to have those meetings with our congressmen. The way you can get involved is just don't be afraid to tell your story. I think everybody thinks they have to have all these statistics. And one statistic that I'm going to throw out there, because I think it shocked a number of people when we went out, because Governor Burgum had announced his candidacy for presidency, we didn't get our lovely little photo op after the bill had passed because he became very busy. So it took us almost a year to get that photo op. And we were sitting around, not with him in the room, but with some other people kind of waiting for him to, arrive and whatnot. And the reporters were there and talking. And Governor Burgum has talked a lot about his wife's advocacy and their work with addiction, which is a very important cause as well. I don't ever pit cancer against diabetes, against addiction. It affects all of us in many different ways. But the thing that's very frustrating is people that overdose have access to Narcan and clean needles. People with type 1 diabetes cannot get access to a life-saving drug, and they can't even get needles unless they go to a pharmacy that's open 24 hours a day and get it behind the counter. Because we've had all of us who have forgotten supplies where we've needed to have a needle just to load our kids' pumps or whatever, and you can't get them because it has to come from a pharmacist.
Angela, can I tell you, I first want to say I've incredibly enjoyed our conversation, and I want to keep having it, and I respect everything you're saying. I don't understand that argument.
I don't either.
I don't understand why someone would say, we need a thing, somebody else is getting the thing they need. I'm mad at them because we don't have it too. Like, I honestly can't wrap my head around the Narcan argument. But I mean, if you have a perspective on it that you want to share, I'd want to hear it.
Well,
I don't get trying to make hay out of somebody else's problem.
Statistically, as I said, the platform has talked about a lot of the deaths from addiction. Mm-hmm. There's been over $100,000 deaths from overdoses, equally or probably more, because people don't always necessarily say that they die from complications of diabetes. There's equal amounts of people dying from diabetes. It's just we have to be able to. It's not pitting one thing against the other. It's making people understand that there are other diseases that are out there that are very similar. Access to medication that is needed.
Yeah. And so saying, if you're going to do it for one person, why are we not doing it for everybody? Is that right?
Right. It had to have been somebody that pushed to get that.
But yeah, that's...
I don't know. I don't know, and I don't care.
Right.
Because it's just, it should be accessible for everybody.
For everybody.
If you can get clean, for everybody. And that's what it's about, is we want people to live happy, healthy lives, regardless of who you are, what you are, where you are. That's just a basic human thing for me, I guess.
There was a time where you didn't need a prescription for insulin. You could just go into the pharmacy and buy it. And you needed the prescription for the needles. And that was in the late 80s or early 90s. You could still do that. I mean, in the end, what happened, if I had to guess, is that, ODing and addiction became such a big story in the country that people, like you, except they're more focused on they probably had family members who OD'd and they were trying to get laws passed around that. They probably had an easier time pushing it through the political system because it was out and the politicians probably wanted to be seen as supporting it. Like, you know what I mean? Like, it's sad. It sounds crazy, but like diabetes needs like enough of that. And I think that's what you're saying too. Like, if people got out there and told their stories to local politicians, maybe they'd hear about it enough that they'd be willing to do something the next time something rolled around. Is that the idea?
Well, it's a part of preventative medicine too. We're going to have less ambulance calls where it's such a burden on the healthcare system for all the complications that come from lack of insulin, and yes, what you're saying, I guess, to generalize what I'm, trying to say too, we have a rural healthcare system, and an ambulance ride is very expensive.
Yeah.
we just need people to get involved and tell their stories. And a very good example of that is unfortunately, it takes somebody passing sometimes. And in Minnesota, the Alex Smith Insulin Affordability Act that allows people to have access to insulin was because a young man, and I saw this post actually happening on the Juicebox Podcast Facebook group saying, I don't know if this is true or not. And is this real? And yes, it's real. It's my neighbor.
Yeah.
It's right next door. He died. He didn't want to ask his mom for help. And I think that comes down to shame. Oftentimes there is a shame factor. People don't say, well, I can't afford my insulin. Well, why don't you work another job? Well, I'm trying to work a job, but I can't because, there's just so many things. And let's just get shame out of the way.
Is Alex's story the one where he moved to a new location? Is that right? And then he got there. No, that's not him.
He's a 26-year-old that didn't have health insurance and he had aged off of his mom's. And he just, said, oh, no, I'm okay. And was waiting to, I think, get health insurance. But, I don't remember the specifics, but it's less than a week with DKA, for somebody to pass. And he had been rationing all along. So, it was a slower progression there. But so she's been very vocal, his mom, and Pay or Die is the video that you can watch about it. Mm-hmm. It does happen. It's out there. And we had an instance not that long ago of somebody, in our group saying, I'm out of insulin. I need insulin. They'd already been to the ER. I'm trying to get on, trying to get some help. It happens.
Yeah. No, I've seen I've seen those posts over the years a number of times where somebody's just like, I don't have insulin. And then people are, try to give them the best advice they can. But oftentimes it ends up being someone who drives out and hands them a vial of insulin,
Yep.
Yeah.
And the thing that's so hard, in our advocacy work is, which really ticked me off in the last session, was not all insulin is created equal. Well, why can't you just go to Walmart? Why can't you do this? And it's like, and what I had said in one of my arguments was, if your loved one is diagnosed with cancer, how about you go get a bag of chemo that was developed 30 years ago?
Yeah.
Is that good enough for you?
Yeah, that ends up being.
So let's move past that.
Yeah, right. No, I mean, and that person should be able to just walk into a pharmacy.
And that was a pharmacist.
Yeah, and say, I'm a type 1 diabetic. I'm out of insulin. I'm in medical trouble. Like, help me. Instead of like having to go to Facebook and say to people, I don't know what to do, or being afraid to tell your mom, or, any other of the endless possibilities.
It's like food. I mean, as I said, I work in our community with our food pantry, and there's a lot of shame that comes with it. People think there's a lot of people that abuse the system, but there are a lot of people that are in need, and we know it. And we just,
Yeah, I have to say there's another argument I don't understand. So I've said this a number of times. Like, in the past, I've tried to get companies to do things that oftentimes their lawyers say they can't do. I've tried to get people to give away pumps. It's hard to do. You can't really give away medical supplies. But at one point while we were having the conversation, I said, why don't we just make it open to people in a certain financial situation? And they said, well, someone's going to lie. And I said, well, that's just the cost of doing business, right? Like, so if you help 1,000 people and 5 people cheat the system, oh, well, like, you know what I mean? Like, you help the other people. But that's another one of those arguments that always stops those conversations. Well, somebody's going to cheat the system. Like, so don't help anybody because of that? That doesn't make sense to me either.
Doesn't make sense. And what the statistics show, I think this was in I can't remember the years. If it was 2021 that the Alex Smith insulin bill came into effect, when we were legislating, but if you Google it, 459 people in the year 2022 or 2023, 459 people had access to insulin because of the Alex Smith bill that didn't previously. Now, I don't know what the year after that's number was, but that's 459 people that needed insulin. So people that were put shame aside and put their health first. Right. And so, we have the numbers there, but, obviously, I'm passionate about that. And I ask a lot of questions. I talk a lot. And I for people, just don't be afraid to share your story. Find your people. And I guess finding the Juicebox podcast, finding the Facebook group, finding people in your arena and seeing what you can do. One of my testimony, when I finished it, what I had said is, if not you, then who?
Mm-hmm. Yeah.
Because I think we just think, oh, they, them. No.
Somebody will handle it.
We're all a part of this. We're all a part of this. If it's not you,
we suffer a little bit too, because generally speaking, a lot of the people hearing this are probably, I mean, if you have time to consider your A1C or your kid's A1C and you have the finances to, get the equipment that you need, and, you have the time in the middle of the day to like go for a walk and listen to a podcast or something like that, like you very well might be a person who's not impacted by the cost of insulin. And then therefore you might be less apt to be involved in something like this. You know what I mean? Because it's not impacting you.
Or maybe you don't have the time. And that's certainly, everybody's circumstances are different. With what I was going to say is when I quit my job, the first thing, I was like, the kids ask, Mommy, what's your title? And that was like, that's the crux of it all. Like, what is my title? I'm mom.
Yeah.
I don't know what my title is right now, but I'm working on it. The other things, if you don't have time, well, then find time with your kids to go to the JDRF events. We have walks. There's a lot of things that you can connect with other people, connecting other people. Just find something to connect with. If you don't have time, you have time to do something.
Yeah.
Contribute in whatever way you can in fashion. And no, not everybody can, but if you think you can, I just want to push you a little bit.
Yeah, go try it. And you can give as little or as much time to it as you can. Like it wouldn't be bad if it was a couple hours a month or, a couple
just
of days.
Educate yourself on the system,
right?
Just find out, because I think you have to do that. I mean, with your own insurance, you just have to be an educated individual.
Yeah. Wow. So, it's really wonderful that you're doing that. It seriously is. And that your daughter got involved, and it's lovely. It really is. I tried for years to do stuff with JDRF, and eventually I got to the point where I thought like nobody's listening to me anymore. And I just tried a different way, and I did this, but I found it really fulfilling in the beginning, like raising money for the walks, going out to the talks and stuff like that. I've given a number of JDRF talks. I still do that. But yeah, I think any way you can help. Yeah.
And so many of these, and I think that's part of it, is so many of them in JDRF too. We've seen it here. These are big organizations. We saw it with the Girl Scouts, when my daughter was in it. Now it's a tri-state organization, so there's just less and less people that are in office to support doing the work. So it lands on the volunteers. So it comes back on us, to do a lot of the things for the walks.
Well, they really scaled back it during COVID.
Yes.
Yeah.
I think everybody did it. It was just the law of numbers.
Yeah.
It is what it is. So yeah, and maybe we'll have an uptick. I know that even the camps for kids, I've been really pushing hard for just advocating for kids, because we do raise money for helping subsidize kids to go to diabetes camp with our local camp, but just trying to get kids to go to those camps too. But same thing, it's just the camp director is in charge of 3 camps in the tri-state area.
Mm-hmm.
What can we do to help support them and get it out? Because it's, for the benefit of the kids.
Yeah.
Use the resources that you have. We all have gifts that we can share and see what you can do with it.
Add to it somehow. Make it better. Just incrementally, even just make things better. No, it's wonderful.
So I guess that's really all that I have.
You were great.
For being a talkative person, I think I've touched on all the things.
I swear to God, I was like, there was a moment when I was like, this one's great. I'm not really gonna have to do much, and she's so interesting. So I was like, this is a nice week off or day off for me. But I still got to have a great conversation, hear a lot of wonderful stuff. There was something you mentioned before we started recording, but you didn't bring it up here. Do you have questions about it, or would you prefer not to talk about it?
No, I think I'm good.
Okay.
The thing that I found out for myself that's just a helpful tip, and then I put it on the Facebook group too, was there are different things over the years that I have wanted to go back on. Maybe for me it's iron or female hormones, or maybe it's GLP-1s or, testosterone or whatever the subject is that you've been having. I was really struggling to find the subject. And when I actually went and searched in the podcast and looked in my library, there they all are.
There it was.
Yeah,
I had a decision to make. I started making it during, I feel like I've said COVID 1,000 times today, but like during COVID, I've said this before, but I feel like when it first started, overwhelmingly podcasters thought, people aren't going to be in their cars anymore. And that's where they listen to the podcast. And those people started scaling back on their content. And I was like, I think people are going to have a lot more time. and I'm going to make more. I had more time and they had more time. And I thought there's so many other things I'd like to talk about. Like, you have no idea. Like, I'll sit down at the beginning of the year and I'll think like, I want to talk about this, and this year. And I make a list for myself. And now here it is August and I'm looking at my list and I'm like, I haven't gotten through half of this yet. That's with me putting out 5 episodes a week. So back when I was doing 1 and 2 and 3, I felt like I'm never going to get to everything. I used to have this horrible feeling of like, well, if I put too much content out, that'll bother people. And then during COVID, I was like, all right, here's 2. Are you bothered by 2? And luckily for me, I have the Facebook group. I can actually go in there and say, listen, I just put out 2 episodes this week. Are you annoyed by that? And people would be like, no, put out more. And I was like, all right, well, here's 3. And they were like, more. And I'm like, 4. And they're like, 4. I'm like, well, there's only 5 days, but here, take 5. And then I started doing these like little, like, there's some episodes that are, I think of as more like, not fill in, but they're shorter, or they're more like focused on like my weight loss story or something like that. I was like, well, I'm putting that on Wednesday and I'm taking a episode away for people who don't care about my weight loss thing. Oh, hell, I'll put that out on Saturday.
Yeah.
People have been really, really lovely about it, and they download and they listen as much as they can. But it just occurred to me at some point, I don't know how crazy this sounds to you, Angela, but when you first start doing this, you feel like everything you record is gold. And you put it out and you're like, here, everyone will listen to this. All the people. And finally one day I was like, everyone's not going to listen to every episode. So here's 5 of them. Pick the ones you want, and maybe you won't want, feet on the floor, defining diabetes. But maybe one day you'll think, God, what is that people talked about? And you'll go back and find it and it'll be there for you. So I think of it as a library.
And that's where I've gotten to too, because I had that guilt feeling like, oh my gosh, I haven't listened to all 1,200 of the podcast, but I don't know that some of the After Dark series pertains to me, or I'm not the type 1 that's living with it, that it's to them. But I just think it's a very vast resource for everybody to go back to and find the things, or go back to it again.
Yeah.
And then the other thing that I really like is I like the transcript underneath. After I've listened to it, you can do a search and look for keywords that maybe you are looking for,
to go back,
and you can copy and paste and send them to your friends and, forward to friends. And, so I do a bit of promotional and advocacy work with your podcast just by sharing, and that's part of it too, is just getting people educated, helping people along with it. Mm-hmm. So I think your platform does that.
I appreciate it. It's hard. Listen, there are people who help me on the Facebook side, and I don't want to say, but they're not full-time, like they're not employees or anything like that. But so generally speaking, this has just been me like raising a barn by myself, basically. I was like, all right, I put one thing down and I was like, okay, what does it need now? I'll add this to it. Yeah. What would support? And
I wish we could do the Juicebox cruise, the Juice cruise, but
would you really go? Oh, that's lovely.
Oh yeah, for sure. But Children's Congress, I'm kind of weighing and what can we do? And and without abandoning my husband on the farm completely, because I am in the tractor. When we were doing some of our loop and learn videos or Joanne Milo, I usually am, hey, it's your tractor friend. I'll be unloading grain and
Joanne is lovely. Zoom. She really is.
Yeah.
No, she's another person who's very dedicated to helping people with diabetes. Just they're everywhere. Like people are like that are everywhere. It's absolutely fantastic. I think you did a good job of representing them today, like all the people out there who are helping. So I really do appreciate that.
Well, that's kind of you to say. Thank you.
No, it's listen, again, you're either lying about this or you're literally doing the work of 93 people. So thank you. It's fantastic. You're a force of nature, to be honest.
I don't feel that way.
No, wait, Angela. Why would you not feel that way? I had a friend that
texted me, and I told, it's like, I'm not sure I'm going to the podcast. Maybe I should just give it up to somebody else that go, maybe they have something, better than myself to say. And, my friend had said, I'll read your book someday. I'm like, why? Maybe it just takes one person. Maybe you can just inspire one person.
I need you to be more introspective. Why do you not feel like a force? I mean, you've just described the efforts of, a dozen people. Seriously. Are you not able to take that as a compliment, or do you genuinely not think you're doing enough?
I think I'm horrible at accepting compliments.
Okay.
Generally speaking, that's just my personality. You look good today. Oh, thanks. I bought this at, a thrift store. Well,
it was
whatever,
cheap.
But it's just
probably the light.
Yeah, I don't know.
Well, listen, this job beat me into taking people's compliments. And I know probably people laugh about that, but you can hear me over the years just like joking my way through it because I felt so uncomfortable. Like even you talking still about like, oh, the platform does a good job of making, data this available. Like all I thought about was I hate making those goddamn transcripts. Like it's such a pain in the ass for me, but like at the same, and I wouldn't read them because it's not how I would access it. But when people told me it was important, I was like, okay, it's important. If it's important to them, then it's important to me. And I make it happen. But instead of feeling that when you say it, I just think, I hate making the transcripts instead of just going, oh, thank you. I'm glad that works.
I'll give you one more plug too.
Go ahead.
That I would say that with the advocacy work, one thing that is also very helpful, there's many different resources that you can find. I mean, I do try to do research. I love to watch Katie Porter, try to take down the PBMs or something like that on Facebook or on YouTube, excuse me. But you have had some interviews, the Orange Book. I listened to that one. I had 3 hours on the way home from a camp with Nina and I had my AirPods in. It was just so fascinating. Is really beneficial for somebody like myself that's doing advocacy work to have these resources outside of it and get kind of that personal, but and factual too, because you do have to have good resources when you're doing advocacy work. I mean, you can tell your story, but if you're actually trying to make effective change, you do need to have information. And there's just so much to learn and I'll never know enough.
Yeah. Oh, that PBM thing.
And I'm 52 and it just rolls off of me sometimes. But
I genuinely think that I'm never going to understand the PBM thing. Like I feel like I'm never
I just say it's
to.
a coconut in a shell game. It just feels like that. And I don't know who's going to crack that nut, but. And
Scott did a great job of explaining. He's really knowledgeable about it too. And that's the other thing. I can't.
Those tabs are still open. I'm still reading through his thing and I'm re-listening to it to understand it and let it sink in.
Isn't it funny too? Because when I said to him, I'm like, there's more stuff you could come on and talk about. He's like, I don't know, like what people would be interested in. I'm like, no, trust me. I'm like, come on and talk about it.
Now you can tell him.
Yeah, trust me. Nobody believes you. Like, listen, you had the same thing. You're like, oh, I shouldn't go on the podcast. I'll be wasting the space. I tell people all the time, you listen to the show, right? And they're like, yes. And I'm like, did stuff help you? And I'm like, yeah. I'm like, well, your thing will help somebody else. And they're like, oh, not me. I'm like, everyone thinks not me, but everyone is the people who helps everyone else.
If not you, then who?
Exactly. I also want to thank you very directly for saying root about 20 minutes into this. It's my favorite part of the conversation. Yeah, you said you wanted to say root. You don't understand that you said root because you're from the Midwest. But
right. Well, and I went to International Music Camp, which is the border in Canada and North Dakota. Yeah. And so we had the Canadians. Is it roof?
Oh, the roof thing is fantastic. But no, you said root, and I was like, oh, that's fantastic. I didn't stop you because...
cause.
Yes. Well, please don't.
Thank you. I told you my accent would be out there, but I've gotten used to yours after listening for quite a long time.
Thank you.
The Jersey accent.
Is it Jersey? I don't know. I grew up in Northeast Philadelphia.
I don't know what it is. It's something, but...
No, it's definitely something. That's for sure.
We're all something.
It's easy to point out because I can't say water, or I don't know exactly how to say it, obviously.
My mom grew up hearing her mom say wash and instead of wash. And so she gets very upset when I say that. But I think it's kind of cool. It's that German, wash. The
wash. Yeah, well, so then you might hear a little bit of that with me because my grandmother was Pennsylvania Dutch. So, like I've said that before on here.
I said, like I knew what that meant.
It's German. It's people in Pennsylvania who are sort of like Mennonites. They're German descent.
Yes, we have Germans from Russia and North Dakota.
Of course you do. People are everywhere.
Yeah.
But my grandmother, she spoke backwards. And I think that's in me a little bit. And what I mean by that, and I always use the same example because it's the example she taught me when I was little, is she said, if there was a cow on the other side of this fence and we were supposed to throw it hay, she would say, throw the cow on the other side of the fence some hay. Like it's all just backwards,
right.
And so I think I have some of that, but I really see it when I'm writing. So when I sit to write, writing a book was horrible because when I sit to write, I write out my thought and then I always realize that the first thing I wrote is the second part of the thought. And then I have to swap it and put it back together again. That happens to me a lot.
I have to cut out about 80% because I wrote a letter to the editor in our local newspaper when I was advocating. And it was just so interesting to me because I found out in 1922, a congressman actually went to Canada to get insulin when it was discovered for his child.
Mm-hmm.
I can't remember the name of him right now, but so I wanted to make this really effective letter to the editor in the paper. And I get flowery and wordy and it's like, nope, I've got to cut it to like 100 words or less. And I was really proud of it when I was done. And it was what it needed to be. But, well, and here we are, at an hour and a half in the podcast. So,
yeah. Hey, tell me that again, though. The congressman did what? And what was the year? So he went to Canada to get insulin for his kid. From what state?
If you learned that life-saving medicine was readily available in a neighboring country to save your dying child's life, would you go to any length to find it? One father did. In 1922, the son of a wealthy American congressman smuggled the newly discovered experimental drug we now know as insulin from Canada so that his son would have a chance at life. And I would have to look, but you can Google it. I didn't reference who the person was. It wasn't Leonard Thompson because that was the first child that got it, but it wasn't Leonard Thompson. But I just found that so interesting because I was trying to write an effective letter to the editor and I'm like, this is interesting because now the year 2023, many Americans without wealth, political connections, or access to insulin are facing that same reality today. 1 in 4 people with diabetes have reported rationing or skipping doses. In North Dakota, we have over 57,000 people living with diabetes.
Wow.
So it was just really interesting. And like I said, I tried hard to pare it down, but I just thought, well, I think that touches a little bit on the reality of what the landscape of our politics are right now.
Okay.
Google that, find it out, but it's still happening.
That'll give people something to do. All right, Angela, thank you for doing this with me. I really appreciate it. Could you hold on for 1 second?
Yes.
Thank you. A huge thanks to the Contour NextGen blood glucose meter for sponsoring this episode of the Juicebox Podcast. Learn more and get started today at contournext.com/juicebox. This episode of the Juicebox Podcast was sponsored by US Med. usmed.com/juicebox or call 888-721-1514. Get started today with US Med. Links in the show notes. Links at juiceboxpodcast.com. Don't forget, if you're a U.S. resident who has type 1 or is the caregiver of someone with type 1, visit t1dexchange.org/juicebox right now and complete that survey. It will take you 10 minutes to complete the survey, and that effort alone will help to move type 1 diabetes research forward. It will cost you nothing to help. If you're not already subscribed or following in your favorite audio app, please take the time now to do that. It really helps the show. And get those automatic downloads set up so you never miss an episode. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. Hey, what's up, everybody? If you've noticed that the podcast sounds better and you're thinking like, how does that happen? What you're hearing is Rob at Wrong Way Recording doing his magic to these files. So if you want him to do his magic to you, wrongwayrecording.com. You got a podcast? You want somebody to edit it? You want Rob.